everybody, my name is Bavisha, and I'm excited to be here today to present my work with Anthony, where we ran a community dance night project in Newark titled Newark Water Coalition Mobile-led Initiative for Community-Owned Managed Research.
Hi everybody, my name is Anthony Diaz. I'm the co-founder and executive director of the Newark Water Coalition. We are a multi-ethnic and multi-generational organization, frontline community members that just started out wanting to do the right thing about Newark's lead water crisis. So our starting point is 2016. That's where 30 public Newark schools tested positive for our lead exceedance. Bard High School tested at 500 parts per billion. You know the EPA standard is 15 parts per billion. Newark Water Coalition, CDC says there is no safe level of lead. So Newark, predominantly African American city, 30% below the federal poverty line, household income about 40,000. So we wanted, the Newark Water Coalition wanted to do research, and we wanted to start a community street team testing about the lead levels in water. But the pandemic happened, and we had to sideline that project, and unfortunately, that's when I met Bavisha, and the street team transformed into the mobile lead testing unit, where we test water, paint, soil, and dust.
So, as Anthony said, when he met me, he posed the research question, is lead poisoning happening in Newark, and if so, where? And at that time, I was building some predictive lead hotspot models, and I was really curious about what was happening on the ground and what primary data would look like to incorporate into these models. So I coupled my research with their research questions, and I said, what are lead exposure sources in Newark, New Jersey? And then I'm fleshing out my dissertation chapters from here. So it looks like question 2 right now is what are the best data exposure models given a community science data set? And question 3 is how might these community science data sets and data exposure models be used for more equitable decision making? And so far we are focusing on question 1, and we started off by getting IRB approval, which required us to work through some paperwork to make sure the Newark Water Coalition could co-own and co-manage the data that we collect.
So we had a bunch of recruitment strategies. The one I really want to focus on is language justice. So I have the copies of the reports here, but here's a copy of the report in Spanish. So one of the things we realized is that our people will utilize and want to be a part of the research, but they need to receive the information in their language. So we also did a bunch of tabling events, and we also do food and water distributions every week. And we had a referral program where we paid each participant in our project $50, and if they referred someone else to the program, we would give them an additional $20. So we were able to test 315 homes, and we ended in November of 2022.
It was important to both of us that the project was community driven and community executed. So we trained a testing team comprising of community members and Newark Water Coalition members, including 5 high school students. We subdivided into lab analysis, data collection, and we had a New Jersey licensed lead risk assessor, a part of the team, who helped us adapt the EPA and HUD methods for lead risk assessment to meet our project. This is a glimmer of what our weekly schedules would look like, and our team getting tested, trained. We did 5 main areas within the testing unit. The first was a home survey where we looked at we collected demographics, home building conditions, and we conducted a health history questionnaire. We measured water in people's home using an instantaneous UV vis or exact lead spectrophotometer, which gave us accurate measurements above 3 parts per billion, and we did both first and fifth draw leader sampling. For paint, we used a portable X-ray fluorescence machine, which allowed us to measure lead base paint concentrations, and we looked at multiple homes and multiple building components within a home. For soil, we used the XRF machine as well. We did in-situ measurements within people's yards by measuring the lead concentration in the soil, and we collected samples and dried, sieved, and ground and measured it later. And for dust, we collected around 2, sometimes more, sometimes less, wipes within a home, and digested those and ran it through ICP-MS. And we have the count of data points we have for each component. As you can see, we have more or less, depending on what it is, as a product of moving samples around and doing community science, as well as some homes didn't have yards or we didn't have access to their spaces outside. So, oopsie.
So what you hear is some results from the home survey. These are pictures from actual homes in Newark, and so it kind of correlates to that median poverty line. And then we took demographics of the people we were testing, and we wanted to know, like, okay, this is what the census data says, but what is the real data in the streets? And then here are some common concerns about drinking water that's in our lead report, but it was interesting to put it all together in a word cloud to present to folks.
Water and paint. So water overall, most of our measurements were pretty low. Newark replaced all of their lead service lines in 2023. We didn't have as much control over stagnation times on the first draw sampling. So, but overall, below the maximum contaminant level was a few outliers. For paint, similarly, we did hit a few hotspots of paint, and this figure shows the census tracts that we covered across Newark with the median lead-based paint concentration. Similarly, below the EPA clearance or threshold level. And our most surprising results were our soil lead concentrations. This plot shows us soil lead concentration per home, or average soil lead concentration per home. And as you can see, it goes up until 8,000 parts per million, which was a little bit surprising. But Anthony challenged me and said, this plot doesn't really tell me a story that I can take back to participants in the study or in the Newark community. So this is a figure we came up with together, where we took the same information, which is lead concentration per home on the y-axis, and we overlaid it with the EPA recommendations on how to protect yourself if you're a participant or a resident in Newark. And I like this plot better because it also shows that a lot of our data was above the gradient that the EPA usually uses to convey health protection measures.
As Bavisha mentioned, we just ran our dust samples through ICP-MS. So we had roughly around 200, 300 samples. And what you see here are the thresholds for both floor and the windows. And so some of the higher dots represent 400 parts per million. So also, this is all in the report, so please, if you have time, get a copy of the report. So some of our members created graphics that were in it. It was very important for us to do a community shareback day because you often have researchers never tell us what actually goes on in our community. So we decided to do it. And it was important to do it before Bavisha went back to school. We also just had a community voice manuscript accepted for publication in Environmental Justice Journal. We gave community members their individual results to let them know what's happening in their home. And we shot a Get Out the Lead documentary about the research project because we wanted to be in control of our narrative. So one of the expectations is like, we gotta throw money at people. You know, people are only gonna be involved if there's money involved. And what we found was actually because we've been organizing in the community for a long time, people trusted us and they wanted to be a part of this project. It is important to pay your community members when they're doing research because they don't have the time to necessarily sit down and participate in these things. And because of an unrestricted grant, we were able to put $20,000 right back into the Newark community.
Another expectation we went into, and maybe because I come from a lab setting, I thought that lab analysis would be relatively simple. However, the cost of getting access to laboratory equipment was one of the biggest barriers we faced, period, in the project. And it raised a lot of tension that can come up between community academic partnerships, especially being explicit about the timeline of when, just the timeline in general of when things are expected, what resources are being brought to the table, and how to split costs and projects as you move through the project. So currently we're sitting and digging through these this data set that we have. I'm hoping to maybe go back to my lead exposure models and see if I can incorporate the age of the households or other correlating variables. Through this project, the Newark Water Coalition was able to purchase an X-ray fluorescence machine for them, and they now have a trained testing team, which allows them to conduct future lead risk assessments, and they're currently doing a mobile lead testing unit in Trenton, New Jersey with another community-based org there. Similarly, we identified the need for lead risk assessors to come from the community, and so Anthony and the Newark Water Coalition is establishing a lead risk assessor training center in Newark, and it will be the first in North Jersey. And they've also established partnerships with Rutgers and Stevens Institute and NJIT, which they've applied for grants to continue doing similar research. And together, along with some other folks, we've recognized some of the bureaucratic and institutional challenges that can come with doing research and getting funding. And so we've recently established a nonprofit called the People's Public Lab, where we hope that we can do more community-driven research and a space for community organizers to come and work with us.
So it was important to tell like how this impacted the community, because one is just actually getting the data for us. But one of our high school members, Jayla Adams, just received a full scholarship to New Jersey Institute of Technology to study environmental engineering as a result of this project. So it's very, very important to be hand in hand with the community. And thank you. So if there's any questions, please get the report, reach out to us. If anybody has funded, hit me up.